So first thing I'm going to do, let me do my face a little bit first. So I'll just topically rub this in. I'll do right around the face and the nose. All right, so pretty simple out of the gate. I'm going to come in there just at like, I've done this before. I'm going to come in at around 0.5. So a little arrow there, 0.5. I recommend going at the higher speed. I find the more it vibrates, this is about 8,000 RPM. That's 8,000 up and down cycles per minute. I find the faster you go, the better, because the more it vibrates, it kind of anesthetizes the area, providing a lot of stimulation. So there's a couple ways you could do it. So on the face, you could do the tic-tac-toe method, where you just come in here like this and you just grid and you just do a tic-tac-toe. So you could do 3 lines and then cross 3 lines. And then you can repeat that if you want, or just keep on moving down the face. So that's an easy method out of the gates. I know I'm having a little bit of gray and a tiny bit of my beard here, my whiskers. So right in here, I'll also tic-tac-toe right in there, just to work on that hair growth, to stimulate some blood flow, and to stimulate some stem cells. So just like that, pretend like you're pushing on a tomato, but you don't want to break the skin. And this is a 16-point pin on that. I'm going to do the same thing over here. And this isn't even that bad. Honestly, I'm going to go up to 0.75, like I mentioned, because that tissue is a little bit more forgiving over here. And you can do a micro roller. I don't recommend it in the hair because it gets caught up. And I do have that. And that's good for like the jawline, just because you can make swift movements. I'll do a video on that some other day. So my pain threshold's gotten much better. So I'm gonna even go up as high as 1 in those areas. Again, starting off, start at 0.25 just so you guys can feel it out. Now for the sideburns here, I recommend just start right down and then just do nice even strokes, just like that. I'm going to go across just a little bit too. Okay, I'm going to go up even a little bit higher on this. I'm going to go to 1.5. Now this is noticeably more painful, but not a big deal. Okay, we're going to do the same thing over here. So just giving you guys the real deal how this actually looks. There's some really good people on YouTube that are estheticians that do some tutorials on this. I'm just giving it to you guys from my perspective and how I do it. And this can be done once a week. You could do your face a little bit more frequently if you're going more shallow. Like if you're doing a 0.25 millimeter, you could probably do it a couple times a week. But if you're going to go deeper, 0.5 or up to 1 on your face, you probably want to give it a little bit more time for it to heal. But just experiment and see what works best for you guys. Now I'm going to go back to my face a little bit. And then afterwards, I'm going to definitely use that hyaluronic acid serum to promote really good hydration of the skin. Don't do any vitamin C. There's some studies showing atopic dermatitis or skin inflammation afterwards doing like vitamin C and things like that. Keep it really, really hypoallergenic. And again, I'll put the links down below for you guys so you have access to it all. You do not want to go cheap on a microneedling pen. You want the best. This is what professional grade estheticians use. You're getting 8,000 RPMs. That's 8,000 times these things are moving up and down. Now I'm going to do my upper lip here. And what you may find is that the hyaluronic acid does kind of get a little bit dry. It absorbs in your skin, which is good, but you may have to reapply. And if you're doing like your upper lip here, this area is really freaking sensitive. So I'm going to come in at it like at 0.5. And just up and down. Ooh, man. And so you can go back over that and trace it over a little bit as well. Ooh, ooh. Okay, now let's do the hair a little bit. So the easiest part is, you can get this hairline going right here. That's where I recommend stimulating that. I'm going to do it without anything. If I feel like I need to add something, I will. I'm going to come in at 1 to start. And I recommend just kind of trace the area here. 1, 1,000, 2, 1,000, and just kind of move it. 1, 1,000, 2, 1,000, 1, 1,000, 2, 1,000. So just about a 2-second hold. And this is the stamp method where you just kind of hold it for 2 seconds and then move. And then you can trace your hairline. That's fine. You could even bring it in a little bit. So like, let's say I'm trying to stimulate a little bit more hair growth. I would actually bring it a little bit here where there's actually no hair, just to provide some stem cell and some blood flow there to really help improve the hair growth. I'm going to go back a little bit as well. And I'm going to come and work right down the side of my head here. Really painful. Oh, man. Oosh. Not bad, though. You get used to it. I find most women handle pain on their face much better than guys, especially if you're used to doing anything on the esthetician side, plucking eyebrows. It's probably about the amount of pain that you would get like from plucking an eyebrow. And you get used to it. And I can go back a little bit just to provide some stimulation. And then I'm going to come here and I'm going to work in. I find if pretend like it's a comb, you can start in the middle and then comb out with your hair. So then I'll just comb right out with my hair. Just like that. I'm going to go up a little bit here now because now I'm going over hair. So I need to be a little bit deeper to overcome the hair follicle that it's on top of. Okay, that's a little painful. And I'm going to just come trace right along it just like that. And I'm going to trace right along it just like that. And again, make sure your hair is clean. Fresh out of the shower is great. I just got out of the shower an hour ago. Really not much product in my hair. Just a biotin hairspray with some zinc in it and some saline. Okay. Now the other side. I'll come right from the middle like this. So there's a couple ways you can go like this, and then you can just stamp it and just go right along the hairline. That's fine. Ooh, man. That's one method. The other method is just pretend like it's a comb and just slowly move it back like you're combing your hair. And again, I'm at 1.5 millimeters right now. Just like that. Good. And then I'm going to hit here. And I'm going to come right down here. And I like to bring it a little bit where my hair isn't, just because I'm trying to provide a little growth there. And come right down the side of my head. Just like that. Right down to the sideburns. And right down to the sideburns. All right, cool. So that's the front part of the head. Let me do the back. And so I'm doing a lot of this stuff just preventatively. It's easy. It's like 10-minute session once a week. And so now I'm going to be at 1.5 here, and I'm going to do the crown. So I'm going to just start here, and I'm going to just grid my way down, and I'm going to just basically do big tic-tac-toe like this. and then I'll eventually go across. And you'll notice my nose is running a little bit because of all that stimulation. And so you can like have a mirror behind you. I'm just generally hitting the entire area. I'm at 1.5 millimeters right now. I was like, you know what? I'm going to do this today anyway. I'm like, why don't I just tape it for you guys so you guys can see it? And guys, this is simple, easy way to keep your skin healthy therapeutically. Totally natural. It's cheap. It's easy. Once you have the microneedling pen, you just got to continue to buy the tips. It's once a week, 10 minutes. And you don't have to do the hair and the face at the same time. You could just say, hey, I'm going to do the hair, take 5 to 8 minutes, do the hair, and then maybe I'll do the face later. That's fine. And so then I'm going to just go like this, and then I'll cross it in a second. I'll even do my part. Like I kind of part my hair just a little bit off center. So I'll just kind of go right through the part just to make sure I'm stimulating some growth there. And then I'm going to come right across. And I'm going to go right through this part here. Right there and right back up. I'm going to do a couple of passes. And if you have really short hair, this mirror, it may be better to do a roller just because you have really good coverage. So if you're a guy, and let's say you're putting your hair really short, you can just use a roller. That's a much better way. And then you could apply like 30 minutes later, you could apply like, if you're doing Jay Campbell's formula, you could apply like the copper peptides. I'll do that in the C60. So just like that. And then I forgot to do between my eyebrows or between my eyes. And then again, that's an area I find that I pinpoint bleed really easy. So you can see I have no pinpoint bleeding at all right now. Estheticians will tell you a little bit's okay. So I'm obviously not pushing the limit that much. But like, let's say you're trying to work on these. Let's say you're trying to prevent like crow's feet, right? Let's talk about that now, where you're trying to prevent some of those classic wrinkles between the eyes, like the number 11 wrinkles that you'll see. Okay, so right here on the eyes, right between the eyes, right under the eyes, crow's feet area, and then just kind of a little bit preventative. Water wipe, great thing to wipe your hands off in between just to keep everything clean. And then I'm going to start off in that area underneath my eyes at 0.5, just because that area is sensitive. And this is where I highly recommend using the lidocaine if you need. I'm going to tough it out for you guys though. Okay, we go to 6. And so you can do the technique where you can just tic-tac-toe across. You can also do minor concentric circles. So you start small and then go a little bit bigger. You can do that. Start small and then go a little bit bigger. Or you can just tic-tac-toe. I'm at 0.5 millimeters right now. Probably went a little fast on that last one. Okay, and then right between the eyes. This is an area where I pinpoint bleed in the past. And you can even do your eyebrows if you're wanting to stimulate eyebrow growth, especially women at the very end. That last little bit third can be done to help with the eyebrow growth. Good, and then I'm going to just make sure I hit here. Any pinpoint bleeding? Just a little bit. A little bit of redness there. I'm just doing the tic-tac-toe method here. Keeping it really simple. I'm at 0.5 millimeters. Tic-tac-toe. All right, that's it. So probably like a 15-minute session to do it all. You can break it up and just do the face. And then again, if you're doing the face before bed's probably the best. So you can see I got probably a little bit of pinpoint bleeding right here, which is okay. And that's the area that I'm the most sensitive in. And so now I'm going to just take a little bit of hyaluronic acid again, and I'm going to rub it right into that area just to really promote good healing and recovery. And now I have all these little micro channels on my face. And so all this hyaluronic acid is going to get absorbed, and it's going to stimulate new collagen. All right, guys, hope you enjoy this video. I'm trying to give you real life stuff so it makes sense. You can see that I'm actually doing what I say. I'm not just like, hey, go poke all these needles in your face, right? No, I'm actually doing it. All right, so what you need, microneedling pen, Dr. Pen 8, don't go cheap. You can use the numbing agent if you need. You can see here I did it without it, no big deal. Hyaluronic acid before to lubricate and afterwards to provide that good building block support for collagen growth. You can get wet wipes, water wipes, simple, just from what my kids have upstairs. Water wipes are good. And I think that's pretty much it. I'll put links down below. Oh, bought a little shot glass too. Put a little press and seal over it and a little bit of isopropyl alcohol. I think you're pretty good.